You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. My first guest is a board-certified plastic surgeon, Dr. Frank Stile. Dr. Stile, welcome to the program.
Thanks for having me again.
Now, before we get into today's topic, you know, we've had you on the program before,
right?
Talking about other procedures. Tell us about your practice.
Well, I have a busy cosmetic surgery practice in Las Vegas, and we do everything from facial plastic surgery, liposuction, and body contouring procedures, as well as the full gamut of breast procedures, including lifts, augmentations, and reductions.
Now, did you always know you wanted to be a plastic surgeon, by the way?
Pretty much. You know, I originally wanted to be an artist growing up, but I have very practical parents who said, hey, do something like become a doctor first, you can always be an artist. And I was lucky enough to find a field that I can do both.
Now, you are a board-certified plastic surgeon. Let's talk about your background.
Yeah, I started my training as a general surgeon at a SUNY downstate affiliate at the Brooklyn South Surgical Training Program, where I did general surgery training. During that time, I did 2 years of research in plastic surgery at New York University, and went on to Mississippi, did a University of Mississippi, did another year of reconstructive microsurgery, and finished off with an accredited plastic surgery training program.
Okay, how long have you been in Vegas, by the way?
5 years.
And you've done some, you know, pretty over-the-top ads in the past.
Well, my ads were basically a tool to let people know that I was actually there. I was new to the community, but that we're talking 4 years ago now. But they were very instrumental.
Very sexy looking ads.
Sexy, provocative, but they were instrumental in my early success. You know, but what most people don't understand is that ads are great at getting attention and getting patients through the door. But if you can't provide the good results that your ads imply, you're not gonna. Your success is going to be short-lived.
And you have billboards in Vegas. Yeah. Are you on the billboard?
I was on a few of my billboards, but I've toned it down a little bit. Basically, now my billboards speak of my practice more than anything else.
You're different than that guy, though, that we see in those ads. And some of the print ads. Because I meet you and off camera, you're a nice guy, you're a funny guy.
Well, are you saying my ads don't say I'm a nice guy?
Well, no, it just, I think it's a different impression. You don't want to see you, you're a very conservative guy, you don't, you're not over the top like that, I should say.
Right, well, you know, that's a matter of opinion, not whether or not I'm a nice guy, but whether or not my ads are over the top. My ads basically mean what they say and say what they mean.
They're artistic, though.
Yes.
I mean, you have an artistic eye.
Yeah.
I mean, you feel that?
It definitely helps in my line of work, yeah. But
you said you wanted to be an artist as a kid. Do you feel like what you're doing is art?
Oh, definitely. I mean, it's the ultimate form of art, you know, using human form as a medium. You know, and it's an unforgiving form of art as well. It does not tolerate mistakes.
All right, liposuction.
Yes.
Is it still the most popular procedure of all cosmetic procedures?
It is one of the most popular procedures in my practice, and that's because both men and women get liposuction.
But nationwide, is it the most
I believe so.
Popular? Why is that?
So.
Why do you think it is? What's driving it?
What drives it are the results. You know, you have a patient group here, a population that's done it all. They've dieted, they've exercised, they've worked out till they're exhausted, and they haven't gotten the results that they've been looking for in these problematic areas.
What's wrong with diet and exercise, though?
There's nothing, and you should continue doing that.
All right.
You know, for overall health. But you know, for someone who's looking to get rid of a problem area, whether it's you know, around your belly button, your flanks, your inner outer thighs, for some of these patients, they're at their ideal weight, but they still do not have the visual result that they want. Liposuction addresses these problem areas for once, definitely, and permanently.
Now our program airs nationwide. I've interviewed a lot of doctors, and most guys don't like liposuction. They say it's very tedious. You like it?
I do. It's hard work for me because I use traditional tumescent liposuction. I don't use powered instruments or ultrasound devices of any kind, but patient satisfaction is my reward.
I mean, are you sculpting? They call it liposculpture.
Absolutely, absolutely. You're taking fat out of certain areas strategically and leaving fat in other areas to achieve an overall improved form. So it is sculpture.
Now, you're aggressive. I mean, we've talked off camera. You say you're aggressive when it comes to lipo. What do you mean?
I'm aggressive with pursuing good results, but not at the expense of safety.
Okay. And now all of your surgeries are done on site at your office.
Right.
You have one OR operating room?
I have 2 operating rooms, but when you say my surgeries are done in my office, I don't want anyone to get the
idea in your office.
that it's done in some back room surgery suite.
Sure.
I have 2 accredited, Quad ASF accredited certified surgery suites that can give most modern hospitals a run for their money. You know, we have the best in terms of equipment and safety equipment.
I've talked to doctors.
Yes.
You know, there's one doctor in particular that comes to mind, Dr. Golpa, says you have the nicest office nicest setup over there in all of Vegas.
Well, that is the highest compliment that another professional can pay to me, you know, and it's because we've invested a lot in terms of planning, money, and time in building a center that meets my standards, which are extremely high.